Hello everyone, this is your friendly neighborhood school nurse, Miss Carrie, and today we're going to be going over the staff and student COVID-19 symptom protocol. We're going to go ahead and train all the staff in the entire district so that if you are called upon to help out at any time that you will have a baseline and know what to do. So daily health checks should be performed for all staff and students, and this will occur whether or not we have students on campus. So if anyone is coming on campus, they will have to go through a daily health check. We'll go over the procedure. So first of all, if you're going to be screening people, you will need to protect yourself. So wear a mask, wear a face shield, and wear gloves. And if you get anything on the gloves, like if somebody coughs or sneezes on them, you'll want to make sure that you throw those away and use hand sanitizer or wash your hands and then put on a new pair of gloves. And then if available, we'll have you stand behind a plexiglass barrier. And that way, if anybody is talking, coughing, or sneezing, you're behind all of those layers. So if there is a barrier in place, you're going to reach around the barrier to take the person's temperature, just like in this picture, and make sure that your face stays behind the barrier. And we're also going to be making some posters. And so using the posters, you're going to ask the person to confirm they don't have any symptoms. So there will be a list of questions and it will ask about coughing, shortness of breath, fever, chills, muscle aches, headache, vomiting, diarrhea, new loss of taste or smell, anything like that. Some people may have a cough or sneezing due to allergies or asthma. So you may want to ask them if this is different from their baseline. If they're coughing a lot, they need to go home. We're also going to be screening the person for visible symptoms, such as flushed cheeks, rapid breathing, or difficulty breathing. And little kids especially become irritable when they're feeling ill. That might be their only symptom. The most important thing is documentation. So for students, you're going to have either a paper or an electronic log, and you'll put in the date and time that you screened them, their name, their grade and teacher, their temperature, and whether they answered yes or no to the screening questions. The screening questions being, do you have a cough? Have you been exposed to somebody with COVID-19, et cetera, et cetera. For adults, we'll also have paper logs and electronic screening logs, and you'll document the date and time, the name of the person, their position, so school custodian, speech therapist, secretary, their temperature, and yes or no to the screening questions. After you've screened them, you'll apply a wristband or a sticker, and your site is going to use a different color wristband or a different sticker each day, and we'll try to have those be the same throughout the district so that bus drivers and different campuses will all have the same supplies. And then this way, it's really easy to tell if someone has been screened. So if somebody comes in earlier or later than other people, it'll stand out whether or not they went through the screening process. Whom should we exclude? Exclude people who have a temperature that's equal or greater to 100.4 degrees Fahrenheit. Exclude people who have any of the symptoms on the poster, and exclude people who look unwell. If one person from a household has a fever, the whole household will need to be excluded. So for example, if there's an employee who has a first grader and a sixth grader, and the first grader has a fever, the employee, the first grader, and the sixth grader would need to be excluded. What should people do if they are excluded? For staff, have them go home, contact their healthcare provider, and contact their supervisor. If they feel well enough, they may be able to work from home. For students, have their parent or guardian take them home, contact their healthcare provider, and if they feel well enough, they may be able to attend class from home if that option is available. For visitors or volunteers, have them go home, contact their healthcare provider, and if they came to campus to speak to a staff member or to solve a problem or to ask a question, they can call or email the staff member instead. When can people come back to work or school? So these guidelines have been changing pretty often. So as of August 11th, 2020, if someone thinks they had COVID-19 or knew they had COVID-19 and they had symptoms, they can return 10 days after the symptoms first appeared and 24 hours with no fever without the use of fever-reducing medications. And their COVID-19 symptoms have improved. So for example, if I was sick today, August 11th, I could return 10 days later. So that would be August 22nd. But it would have to be longer if I still had a fever or if my symptoms hadn't improved. But as long as I was feeling well, I could come back on August 22nd. So basically, it's whatever the longest amount of time is. When can people come back to work or school? Most people do not require COVID-19 testing to decide when they should be around others. If you're sick, you shouldn't be around other people. However, if your healthcare provider recommends testing, they will let you know when you can resume being around others based on your test results. So in that case, the student or the staff member would bring in a note from their doctor saying they had a positive test at such and such date and they can return to school or work, blah, blah, blah. If they weren't tested for COVID-19, we would use this 10-day guideline. For more information, here is a link for the CDC website. This has additional information for people who are immunocompromised or were exposed to somebody with COVID-19, or this, or that, or this, or that. So there's a lot of different variables. And so if you go to this website, it will give you the updated information for your particular situation. Locations of screening stations. The students and staff will be screened upon arrival at the bus or on campus. Where will the screening stations be? So before entering the bus driver or bus attendant will be screening students and any staff that are going to be riding the bus. Students will be screened before entering the cafeteria for breakfast. And anyone will be screened before entering the school office or school campus. What about employees who arrive early in the morning? So we have all our happy, bright students here. They're here really early in the morning to make breakfast. So who is going to be screening them? So employees who arrive before others, for example, the cook manager, custodians, or secretaries, they will screen themselves and document their own screening on the screening logs. Helpful tips. Check student temperatures before their parents drive away. Otherwise, they are not coming back. So make sure you check the student before their family drives away or walks away if they walked them to school. Also, many hands make light work. We will need many staff members to help with the screening to make it go as quickly as possible. What should we do if someone gets sick at school or work? Immediately isolate them in the sick room. For employees, they can just go straight home. And all people should contact their healthcare provider. They cannot return until they meet the CDC and Yolo County criteria. We should close off the areas used by the sick person. So for example, the sick room, their classroom, their office, etc. And we need to wait at least 24 hours before cleaning and disinfecting those rooms. You can improve ventilation to shorten the time it takes for respiratory droplets to be removed from the air in case you need to use the room sooner than 24 hours later. What if someone tests positive for COVID-19? The district would notify the local health officials, staff, and families. Be sure to protect the person's privacy according to the Americans with Disabilities Act. So don't share someone's name and don't share their position if they're maybe the only person. So for example, if you say it's an administrator and your school only has 2 administrators and one of them standing next to you, you haven't protected that person's privacy. So make sure you just say that an employee or a student tested positive. Close contacts of that person must stay home if they develop symptoms. If you have any questions about health specifically, you can contact your school nurse. So for now, it's Carrie, myself, or Leanne. And if it's about site-specific needs, you will contact your administrator. Thank you so much and have a great day.